I'm Dr. Deborah Peinels, a psychiatrist who has worked with people with serious mental illness and intellectual and developmental disabilities throughout my career. I am a senior medical and forensic advisor at the National Association of State Mental Health Program Directors, a consultant to the National Association of Directors of Developmental Disability Services, and adjunct clinical professor of psychiatry at the University of Michigan Medical School. This module will cover the risks of over- or underprescribing of pharmacological interventions for individuals with IDD. This includes the risks of polypharmacy and complex drug interactions to be mindful of, as well as the potential for missing co-occurring mental illness or physical health conditions. The risk of psychiatric disorders is 3 to 4 times higher in people with IDD than the general population, but psychiatric disorders may manifest differently in persons with IDD. The NADD, in partnership with the American Psychiatric Association, has developed the Resource Diagnostic Manual for Intellectual Disability, which suggests how psychiatric diagnoses can be adapted in working with people with IDD, and is a great resource. People with IDD are at risk of a prescribing cascade, where the side effect of drugs are misdiagnosed as symptoms of another problem, resulting in more medications being prescribed, or where symptoms are not well treated and more medications are prescribed. Children with IDD are more sensitive to the side effects of psychotropic medications. Medical conditions can also be overlooked among individuals who are not well equipped to verbalize or localize pain, describe symptoms to assist the clinician in identifying somatic conditions, and may result in misdiagnosis or missed diagnoses. For some individuals, aggression or disruption might be a method of expressing pain or distress from a medical condition. Trauma exposure is very high for people with IDD, and trauma can manifest in ways that seem out of character or unexpected for the person, and the ability to express trauma-related symptomatology may be limited, and therefore trauma and its sequelae can be missed. Whenever an individual is prescribed 2 or more psychotropic medications, whether in the same class or in a different class, it is important to regularly review the medication regimen for side effects and cross-reactivity and necessity. We want to make sure that the treatment regimen is as simple as possible for the individual to take and as simple as possible to understand what might be benefiting the symptoms or causing side effects that are unnecessary. The diagnostic manual developed by NADD can be helpful in understanding symptom expression. Consultation with knowledgeable colleagues may also be helpful. A pharmacist who specializes in behavioral health and drug-drug interactions can also help the prescriber to ensure that proper medication and medication combinations are being utilized. Again, monitoring and self-checking for overprescribing or looking at the person's presentation to ensure that we've identified symptoms that should be addressed with pharmacology are being addressed are both important sides of the continuum. In Module 3, we will discuss developing and implementing a person-centered treatment plan with pharmacological approaches.